Hello, I'm Dr. Elizabeth McMahon, licensed psychologist and author of Virtual Reality Therapy for Anxiety, a guide for therapists. And I'm here today to talk about virtual reality, or as it's called, VR, and how it can be a tool for mental health and wellness. So let's start with what virtual reality is and how does it work? To enter virtual reality, you put on a headset. And when you put on the VR headset, you're put into a virtual world that surrounds you. For example, you may enter a beautiful virtual meditation garden. So everywhere you look, you simply see the garden around you. Perhaps you hear the sounds of bird calls or the wind in the rushes. Entering a virtual meditation garden may help you relax more deeply, may help you reach deeper levels of mindfulness. Experiences in virtual reality can help you in real life because in virtual reality, you can practice new skills, you can face fears safely and gradually, you can prepare for real life challenges. And virtual reality has all kinds of mental health and wellness uses. Virtual experiences can lift your mood, calm you, relieve pain. They can help with people struggling with addiction to drugs, alcohol, or tobacco. And VR is used with all kinds of fears and phobias and anxiety problems, including social anxiety, fear of public speaking, driving, flying, post-traumatic stress disorder. Because in VR, you can face what you fear, but with your therapist with you, supporting you, guiding you, protecting you, controlling the virtual experience so that you're facing your fear as if you were out in public, and yet you're protecting your privacy. Your therapist can control your experience so that you have optimal therapeutic benefit. For example, if you're afraid, say, of flying, your therapist might have you take off over and over and over and over until takeoff no longer scares you, until the sounds and the sights of takeoff become familiar and comfortable. Now, you may wonder, well, does virtual reality really help people get over fears in real life? I mean, you have a headset on, but it's amazing. You enter a virtual world and it feels like you are truly there. It has impact. So the answer is, can VR really help? Is absolutely yes. It can and it does. I've seen VR help people get over fears of flying, driving, public speaking, fear of needles, heights, claustrophobia, all kinds of fears. The success rate is high, and sometimes treatment can be surprisingly fast. If you're a therapist who's listening, I've been using VR with my clients since 2010, and I've been teaching other therapists to use VR in therapy since 2011. If you're interested in learning more, you can get 30% off if you pre-order Virtual Reality Therapy for Anxiety, a guide for therapists from Routledge using the code ADC21. If you're just someone who's interested in learning more about anxiety or panic, please listen to my other Hive 80 podcasts. And perhaps you might want to get the workbook, Overcoming Anxiety and Panic, Interactive Guide, which explains how anxiety and panic work and how to overcome them. Thank you for listening, and congratulations on learning skills to help your own mental health and wellness.